Whenever one talks about men versus women, there's this risk of being accused of making gross generalizations about sex differences or gender differences. From a psychosocial point of view, I think a lot of the gender stereotypes come through loud and clear. Men don't ask for directions, right? So men are less likely to speak up and ask for help. They are less likely to talk about their feelings and their emotions and say, I'm hurting, I need support, I need help, when they need it just as much as women do. They do contact the National MS Society, where I am, for information in the appropriate numbers relative to how many they are in the population. But when they call, they tend to talk more about, they want a referral, they're looking for facts, they're looking for a resource. They don't call because they need to talk to somebody or need support. So one has to actually do a little more probing, a little more prodding to get them to talk about what's really on their minds. If you ask direct questions, my clinical colleagues say to me, they will answer questions. They'll answer questions about their symptoms, their mood, their cognition, but they won't bring it up themselves as easily as women will. There's also some research that shows that in terms of self-efficacy, that women actually have more confidence in their ability to handle MS than men do. I think we have a group of people who are really struggling to take it like a man, whatever that means to them in this culture, and therefore have a little more trouble seeking out and accepting the support and help they need, because they feel they should be able to do it on their own. They feel they should be able to fix this their own way. So they're really into what exercise should I do, what food should I eat, what this, because they want to own it and take care of themselves, and then when they can't, because MS doesn't behave the way they want it to, they have a tendency to feel like they haven't been tough enough or worked at it hard enough. I think we have to be proactive with men and engage them and educate them so that they feel like it's okay to speak up and ask for help. And the same thing is true for men who are support partners, that they may feel that as a spouse or partner they should be able to fix the problem, they should be able to take care of it and do it, and when they can't, I think that's a real struggle for them. And all support partners are neglected. Nobody is busy asking them how they're doing or what they need or what they're afraid of. Everybody's all focused on the person with MS. It's particularly true for the men who aren't going to speak up and say, hey, I can't do this, or I really need help. So I think as clinicians, we need to make sure that those men who feel like they need to tough this out on their own are getting the message that it is okay to need some help with this, that MS, whether they have it themselves or their loved one has it, it is a pretty challenging disease. I've worked in the field of MS my entire career, and so I can't speak to how it is in other conditions, but from the limited experience I've had in meetings with other organizations like the National MS Society who are dealing with other patient populations, I think it's very similar, particularly for the support partners, where male or female support partners are struggling, and the men, again, struggle because they feel they should be able to do this. In terms of other medical conditions, my guess is that we would see very much the same thing. Another interesting difference, men tend to be bigger risk takers than women, just in general. Men are more likely to take risks. risks. And how that translates in MS is they are much less likely to engage in preventive healthcare strategies. It's much harder to get a guy to just go get an annual checkup or do the regular stuff. But it also means they're slower to report a symptom or a change or a problem. They're willing to live with the risks. They're slower to start treatment. But when they do start treatment in MS, they're much more likely to go for the big guns, whatever they perceive the big guns to be, because, you know, if I'm going to do this, I'm going to do it right, and I'm going to really beat this thing. And so then they may end up taking more risks as they balance risks and benefits of different treatment options. They may say, oh, well, I'll take that risk because I want to make sure I'm getting the biggest, baddest treatment that I can get. And I think that is a big difference between men and women. And I don't know how that translates in other medical conditions, but I think we see that in MS.